complete physical assessment and vital signs, I will assure that the patient is on a safe position and comfortable. The rails of the bed are going to be up to a vent. The cold light is going to be close to the patient at all moments. And the bed is going to be in a position that is comfortable for me and for the patient. Hello.
Hello.
How are you?
Good, thank you.
Good. My name is Miriam Basulto. I'm going to be your student nurse today. I'm going to be taking your vital signs and doing a complete physical assessment on you. That's going to require me to touch you and be close to you. That's fine?
Yes.
Okay. Can you please tell me your first and last name?
My name is Monica Miranda.
Monica Miranda. Okay, nice. Thank you, Monica. Monica, do you have any allergies
No.
to latex or something like that? Any food? No. Okay. I'm going to put the bed up to a comfortable position for the patient and for me. And the rails, two of the rails of the bed they're gonna be up for safety. Okay, Miss Miranda, what brings you to the hospital today?
I'm here because I'm feeling a pain in my back.
Pain in your back? Okay. What causes this pain, Miss Miranda?
Any strong movement?
Strong movements. Okay. Is there any movement that makes it worse?
When I bend?
When you bend. How does it feel like this pain on your back?
Like somebody's stuck me in the back.
Does it radiate to some other place in your body?
No.
No. How would you categorize your pain from 0 to 10 being the worst pain in your life?
Number 6.
Number 6. How long did you have this pain for, you said?
Like 30 days ago.
30 days ago. Oh, wow. And had you had this pain before?
No.
Okay, let's remember. So I have assured that my patient is alert, awake. My patient is conscious. She knows that she's being treated for pain. Now I'm going to proceed to do the vital signs. I have gloves on. I'm going to start taking her temperature axillary. Okay. And at the same time, I'm going to be taking her oxygen saturation. Preferably in the hospital, we will take the temperature orderly. Thank you, Ms. Miranda. The temperature is 97.4. And your oxygen saturation is 98%. I'm going to proceed to take the pulse, the apical pulse, which is located on the Erb's point, the 5th intercostal space. Would you displace your breast for me, please? We're going to count for 1 full minute. 84 beats per minute. I'm going to take her respiratory rate for 1 full minute. Okay, 20 beats per minute, 20 respirations, I'm sorry. Okay, Miss Miranda, I'm going to take your blood pressure. Okay, please uncross your feet. It's going to be a 2-step blood pressure. Okay. It's around 100/60. I'm gonna wait for 30 seconds. Then I'm gonna take it with my stethoscope. Miss Miranda, your blood pressure is 100/. Hello, how are you?
Good, thank you.
Good. I'm Miriam Basulto. I'm going to be your student nurse today. I'm going to be doing a physical assessment on you, okay? I was going to require me to touch you, be very close to you. Do you have any problem with that?
No.
Can I please see your wrist then? I'm going to please put gloves on. Please tell me your first, last name, and date of birth.
Monica Miranda, October 13, 1989.
Thank you. I'm going to assure privacy, close curtains and doors. I'm going to put the bed up to so I can be comfortable and the patient too, and 2 rails of the bed up too for security and safety. I'm going to start from inspecting the head and the neck. I'm going to start popping the head to see if there's any bumps of mass. and the distribution of the hair. Okay? Everything looks normal. Then I'm gonna change my gloves, clean my hands, put new gloves on, and then I'm gonna start inspecting the ears for drainage, placements, cerumen, or anything like that. Turn the air up a little bit. Everything looking good, normal. Very good. Then I'm gonna start assessing the cranial nerve number 8, auditory. For that, I'm gonna ask you, Miss Miranda, please cover one of your ears. I'm gonna whisper something, and you're gonna tell me what you hear.
Pineapple.
Very good. Then next ear, please.
Banana.
Yes. Thank you, Miss Miranda. The cranial nerve number 8 is intact. I'm gonna inspect the eyes for symmetry, and I'm gonna inspect perla. Okay, Miss Miranda, look up for me, please. Look to the front, please. Yeah. You can see the pupil constructing. Very good. Please, Ms. Miranda, can you look at the front and tell me what it says on that signs over there?
The life is good.
Okay, good. Cranial nerve number 2, optic nerve, is grossly intact. By the way, Ms. Miranda, do you have any visual problems?
No.
Thank you. Next, I'm gonna assess cranial nerve number 3, oculomotor, number 4, trochlear, and number 6, abducent. For that, I'm gonna ask the patient to follow my pen. Okay? Without moving the head. Cranial number 3, grossly intact. Number 6, grossly intact. Number 4, grossly intact. Very good, Miss Miranda. I'm going to inspect your nose now. Can you tilt your head up a little bit? Okay. Everything looks symmetric. I'm going to present two smells to you, Miss Miranda, and you're going to tell me what they are. For that, I'm going to ask you to please close your eyes, and you're going to tell me what are you smelling.
Alcohol
Very good.
and perfume.
Very good, Miss Miranda. I'm gonna inspect the face for symmetry and the color of skin. Everything is looking normal. I'm gonna assess the cranial number 5, trigeminal and facial. For that, I'm gonna ask Miss Miranda, please, to smile for me. Very good. And I'm gonna ask you also for the sensation of your face. This is gonna be dull. This is gonna be sharp, and this is gonna be dull. You're gonna tell me what you're feeling. Please close your eyes.
Sharp and dull.
Very good, Miss Miranda. Cranial nerve number 5, trigeminal, and 7 are grossly intact. Next, I'm gonna palpate the sinuses and the lymph node. This is the frontal sinuses, ethmoid sinuses, and maxillary, looking normal. And then lymph nodes, they don't look swallowed. Very good, Ms. Miranda. Then I'm going to ask you please to open your mouth and stick your tongue out. Please. Open. Very good, Ms. Miranda. Can you please move your tongue side to side, up, down? Can you please swallow for me? Cough. Very good, Ms. Miranda. Doing that, I just checked on number 9, glossopharyngeal, number 10, vagus, number 12, hypoglossal, and number 10 is going to be spinal accessory. I'm going to ask her to please show your shoulders. Thank you. And then move my hand, please, to one side. One. Okay. Thank you, Miss Miranda. I'm going to palpate her neck for nodules or mass and carotid arteries, and I'm going to auscultate them too. See? I don't feel any nodules, any masses. And I'm going to auscultate with the bell of my stethoscope. Okay, Miss Miranda. Don't breathe. Very good. Thank you, Ms. Miranda. Okay, Ms. Miranda, we're going to be checking now your skin, your thorax, heart, and lungs, right? Okay. Through your skin, we don't find any marks, any skin breakdown. Normal temperature. Normal color that match her ethnicity. Also, we're gonna check the turgor. For that, we're gonna do it on the chest. We're just gonna pull a little bit off. Perfect. Now we're gonna inspect your heart, lung sounds, and your thorax. Can you please sit for me? Thank you. Can you please inhale, exhale. Again, inhale, exhale. Very good, Ms. Miranda. Lay down, please. Lay back. Thank you. Now I'm going to inspect your chest. Your chest wall for any tenderness. Do you have any tenderness?
No.
No? Okay. I'm going to inspect your heart sounds, okay, Ms. Miranda? Very good. So external notch right here. In the second interspace to the left, we find the aortic area. Then to the right, second intercostal space, we find the pulmonic area. In the third, we find the Erb's point. Then for intercostal space, tricuspid valve. And in the fifth intercostal space, towards the midline of the clavicula, we find the Erb's point. And now I'm going to be auscultating your lung sounds. Can you please sit for me? Thank you. Your feet down, please. Thank you, Ms. Miranda. Okay, I'm going to be auscultating your bronchial, bronchivesicular, and vesicular sounds in 8 points on your chest. Deep breath, please. Miranda, can you please turn around? Okay. Here. Now your bronchivesicular and vesicular sounds. Can you please breathe through your mouth deeply? Vesicular sounds through your mouth, please. Okay. All normal breath sounds. You can lay it down, Miss Miranda. Do you smoke?
No.
No. Okay. Very good. Okay, Miss Miranda. I'm gonna really quick check your JDD. For that, I'm gonna put the head of the bed up to 45 degrees. I'm gonna ask the patient to look to the side. And I'm gonna put the bed from supine to 45 degrees if, to check if there's any distension on the jugular vein. Okay. I'm also gonna check her pulses. I'm gonna auscultate her temporal artery for any bruises using the bell. There's no bruise. Okay, Miss Miranda, we're gonna be checking now your back. Okay. Can you please sit for me? Thank you. Okay, there's no deformations on the back. I'm gonna also auscultate the lateral sounds. I'm gonna ask you, Miss Miranda, please breathe through your mouth. And the other side, Miss Miranda. Breathe through your mouth, please. Very good, Miss Miranda. There are no abnormal sounds. Now I'm gonna inspect your abdomen. Please, can you lay back? Thank you. Okay, there's no deformities or bumps on the stomach. I'm going to auscultate for bowel sounds. There are bowel sounds on the 4 quadrants. You want to also palpate, see if there is any mass. When was the last time you had a bowel movement, Ms. Miranda?
Last night.
Last night? Okay. Do you have any pain when you urinate, any blood on the urine for odor, Ms. Miranda?
No.
Okay. Do you have any nausea, vomiting, any difficulty eating?
No.
Okay. Okay, Ms. Miranda. Now we're going to be checking your upper extremities. For that, I'm going to ask you to move your arms laterally. Can you please sit for me? Thank you. Okay. Flex them. Make some resistance. Up. Down. Try to flex your arms with my arm in. Very good. There's a stretch. I'm going to check your pulses radially. With your other hand, please. There's a presence of pulse. Brachial artery. Okay, maybe around that. Very good. Let me check your ulnar pulses, please. Okay, bilaterally, strong. Very good, Ms. Miranda. Can you please lay back? Thank you. I'm going to be expecting your lower extremities. Can you please put your feet up? Okay, make some resistance. Again, the other one. Can you flex them? Okay. Okay, Ms. Miranda. Very good. I'm going to check for any bruises, any marks on the feet, capillary refills. Less than 2 seconds, less than 2 seconds, less than 2 seconds. Good. In your hands, can you put up? Thank you. Less than 2 seconds, less than 2 seconds. Very good, Ms. Miranda. I'm going to be shaking your pulses, your dorsalis pedis pulses. Okay. For that, I'm going to move the camera. There's a presence of pulse. And then dorsalis pedis. And popliteal artery will be around here. Dorsalis pedis. Pulse. Very good, Ms. Miranda. I'm going to ask you a few questions now. Do you plan on hurting yourself or others?
No.
Do you feel safe here at the hospital or home?
At the hospital.
Do you feel safe home?
Yes.
Okay. Okay, Ms. Miranda, that was everything. Thank you for letting me do a physical assessment on you. For that, after I finish, I'm going to put the bed on the lowest position. The rails of the bed are going to be down. I'm going to be up. Sorry. The cold light is going to be on reach. And I'm going to tell the patient that if she needs anything, she can just press the cold light. I'm going to wash my hands, and I'm going to close the door for the patient.